Hi, I'm Ashley Mohadjer, interventional cardiologist at Baptist Fort Smith. Born in Texas, but spent most of my time growing up in Southern California. But I've been a little bit of everywhere for school and training. So went to undergrad and medical school in Southern California, and then left for my internal medicine residency. I was in Cleveland, Ohio. Enjoyed the snow for a few years. Then went south to Florida, Gainesville, Florida, where I did my cardiology fellowship. And then went to Nashville for my interventional cardiology training, and now I'm here in the great Fort Smith, Arkansas. When I was young, my grandfather had a lot of health problems, had a bypass surgery, had congestive heart failure, and ultimately underwent a heart transplant when I was pretty young. So I had a very early exposure to the medical field, to cardiology. And I always liked school, I liked science, I found it interesting, and in the end decided that that was the area of interest to me, but I wanted to help patients like him. I was a professional ballet dancer for 7 years and danced for about 16 years. So huge part of my life, really enjoyed it. Highly recommend it for anybody out there who's interested. I owe a lot of my success in medicine, just discipline to studying and perseverance and, these sorts of things to early lessons that I learned in the dance world. I think it's made me a better team player. I think it's made me a better leader. And I definitely draw upon those sort of multitasking skills even now in the cath lab, where there's a lot of things happening at the same time, and we kind of have to take stock of everything all at once and prioritize quickly and kind of manage a lot of different moving parts at the same time. I think patient education is huge. So for me, I love teaching medical students, residents, fellows, and I think that same philosophy applies to patients. I think everybody should understand what their health conditions are, what's going on in terms that they're able to understand and know what's going on with their health and be able to ask informed questions. And so I do spend a lot of time just kind of going over things with my patients and making sure that I answer their questions and help them to understand what's going on with their health now and what things we're doing to try to improve their health overall and things that they can be working on at home. So as an interventional cardiologist, heart attacks are sort of my bread and butter. So treating folks with heart attacks, blockages in the heart arteries or coronary artery disease, and putting stents in people's hearts. That's what I do primarily in the cath lab. I'm pretty passionate about what we call intracoronary imaging. So it's essentially a way for us to take pictures inside the blood vessels that supply blood to the heart, and that helps us to understand why those blockages formed, what types of plaque buildup is in those arteries, and how best to treat that so that we can get patients the longest lasting result from their stent procedure possible.